Friends, in today's video we will talk about which lentil is best to eat for diabetic patients. Diabetes is a condition in which our body does not properly use glucose, causing it to accumulate in the blood and leading to high sugar levels. You already know that diet plays a very crucial role in diabetes, because the sugar entering our blood comes directly from what, how, and how much we eat. Therefore, it is extremely important for diabetic patients to eat the right things and eat correctly. You may have often heard the song, "Eat lentils and flatbreads, sing the virtues of the Lord." Lentils are often considered food for the poor. But did you know that these lentils are an amazing food for health? Very beneficial indeed. Their marvel lies in the fact that they are rich in protein and fiber, and their glycemic index is quite low. This means they digest slowly in the stomach, so blood sugar levels do not suddenly spike and remain controlled and constant. In today's special video, I'm going to tell you about a very good lentil that is best for diabetic patients. In addition to this lentil, I will also give you 4 extra options in this video that provide more or less the same benefits. They are as good as the best lentil, but they give you an additional option since obviously you cannot eat the same lentil every day. With these 4 items, you can add some variety to your diet and enjoy them without getting bored. Let's begin and see what is at number 5. I have arranged the video step by step in a ranking order. We will start with number 5 and eventually move to number 1, which is the best for you. Number 5. Chickpeas. Chickpeas are full of protein and fiber, and their glycemic index is low, around 28 to 33, which places them in the low category. This means that when you eat chickpeas, they do not immediately raise your blood sugar levels but keep them constant. The high fiber content in chickpeas slows their digestion process, so they digest gradually, releasing sugar slowly into the blood instead of causing a sudden spike. Moreover, an interesting study shows that if you regularly eat chickpeas, they can reduce insulin resistance in the body. Insulin is the hormone that helps carry glucose from the blood into our cells. Think of it like this. If your house has a locked door, you need a key to enter. Similarly, your cells are like houses, and the door to let sugar in is unlocked by insulin. If the key, insulin, doesn't work properly, the door won't open, and the sugar remains in the blood, eventually leading to diabetes. Chickpeas not only help maintain your blood sugar but also significantly reduce the risk of diabetes, even in people without high sugar diabetes or those in pre-diabetic stages. There are 2 types of chickpeas, Kabuli chickpeas and local chickpeas. Both are good for diabetes. However, if you compare them closely, local chickpeas are slightly more effective. So, use local chickpeas more if you can, but if you prefer Kabuli, you may use those too. Choose whichever you like. Number 4. Mung lentils. Mung lentils come in 2 types, yellow mung lentils and green mung lentils. In yellow mung lentils, the skin is removed, while in green mung lentils, the skin remains intact. The skin contains fiber, which means technically the green mung lentils are healthier and more suitable for diabetes. However, for variety, you can also eat yellow mung lentils without any problem. The glycemic index of green mung lentils is 38, which is quite low. It is especially beneficial for pregnant women or people with heart problems or general bodily weakness. For diabetic patients, who are at a significantly higher risk of heart disease and high cholesterol, eating green mung lentils 1 or 2 times a week can help lower cholesterol and improve heart health. In cases of diabetes during pregnancy, green mung lentils are highly recommended to be consumed daily. Number 3. Black beans and kidney beans. Black beans and kidney beans are not only very tasty, but also have amazing health benefits. They are a very rich source of protein and fiber, and their glycemic index is only 19, which is extremely low. They greatly help in stabilizing blood sugar. Additionally, they are full of antioxidants, which are beneficial for the eyes, skin, and overall health. When cooking these beans, remember to soak them in water for a few hours before cooking and ensure they are well cooked, as undercooked kidney beans or black beans can be harmful. With this in mind, you can comfortably eat them 2 to 4 times a week and see how much they help control your blood sugar. Number 2. Red lentils. Red lentils are extremely beneficial for diabetes. Their glycemic index is only 25, which is quite low, making them very suitable for diabetic patients. Red lentils are not only a good source of fiber and protein, but also contain iron, B vitamins, and minerals, all of which are particularly beneficial for your overall health, something that is very important for diabetic patients. To prepare red lentils in a diabetic-friendly way, Use minimal oil and healthy spices such as cumin, garlic, asafoetida, and turmeric. These ingredients make the lentils even more nutritious, beneficial, and enhance their flavor. When used in this manner, red lentils become an excellent diabetic-friendly food. Number 1. Split chickpeas, also known as split Bengal gram. The best lentil for diabetes is split chickpeas. Their glycemic index is an unbelievable 8, extremely low, so diabetic patients can eat them without hesitation to their heart's content without any worry. Split chickpeas are rich in protein and fiber as well as folic acid, which helps produce new blood cells and strengthens nerves. If someone has diabetes along with weakness, where nerves have become weak or there is a shortage of blood, then split chickpeas are a perfect option that can be eaten freely in the morning or evening as much as desired. This was today's video where I discussed the best lentil for diabetes, split chickpeas. Along with that, kidney beans, black beans, red lentils, and mung lentils are also excellent diabetic-friendly options that will keep your diet varied and enjoyable. Before wrapping up, here are a few additional tips. 1. Portion control. For each meal, allocate 50% of your plate to vegetables and salad, 25% to lentils or other items mentioned, and the remaining 25% to flatbreads made of whole wheat or millet. Always choose whole wheat or millet flatbreads as they are best for diabetic patients. 2. Variety is key. Do not depend on just one item. Have a balanced meal that includes some carbohydrates, a little healthy fat, and plenty of proteins and fibers. 3. Know your body. Every diabetic patient's body is different. Understand your body, recognize your requirements, and take the appropriate steps accordingly. With that, I will meet you again in a new video. Until then, keep smiling, keep learning something new every day, and stay healthy.